Hey guys, Dr. Hagmeyer here. If you're new to my YouTube channel, I just want to take a moment and I want to welcome you. And of course, if you find today's information helpful, be sure that you hit the subscribe button. And of course, without saying, check out the other videos that I've done. I've done lots and lots of videos related to thyroid problems, and I think you'll find a lot of value in these videos. Today, I thought I'd shoot today's video really just as a reminder to so many of you who are out there struggling with thyroid disease. I see lots of bad information on the internet when it comes to the treatment of thyroid-related problems, including Hashimoto's disease. And quite honestly, after I had a conversation this morning with a new prospective patient, it really gave me the idea to really shoot today's video, like many other videos that I've done. So today what I want to do is I want to arm you with 5 things that are sabotaging your success when it comes to treatment for thyroid-related disorders, including Hashimoto's. So reason number 1, and what I'm going to do is I'm going to give you these 5 things that are sabotaging your thyroid, and I'm going to explain in much more detail after we've listed them out for you, okay? So number 1 is, of course, not getting tested for Hashimoto's disease, but also taking iodine supplementation without knowing this, all right? Number 2 is relying on T3 replacement to fix your thyroid, or switching from one medication to the next. I see that happening day in and day out. Number 3 is relying on thyroid replacement to fix your problem if you have thyroid disease or you have Hashimoto's disease. Number 4 is not having your doctor run a complete thyroid panel. This is huge. You must have a complete thyroid panel in order to get to the root cause of why you have thyroid disease. And finally, number 5, not looking at the big picture and treating the root cause. Now, let's unpack these 5 things that are sabotaging your thyroid treatment success. Number 1 is not getting tested for Hashimoto's. Okay, this is one of the biggest errors I see in medicine today, and it's just not getting tested on top of taking iodine supplementation. It's very, very simple to do. Why is this so important? Why is this so dangerous, right? Here's why. The number 1 cause of low thyroid disease, hypothyroidism, euthyroidism, underactive thyroid, is something called Hashimoto's disease. And if you are unknowingly taking iodine supplementation, like so many people do, because it's found in almost every thyroid natural supplement, you are potentially causing more damage to your thyroid. Now, some doctors will argue that people with Hashimoto's disease can take iodine supplementation and that iodine is only a problem when a selenium deficiency exists, but I'm not convinced that it's that simple, all right? When it comes to gambling in respect to turning on and flaring up an autoimmune disease and potentially lighting up the immune system, I rather err on the side of caution. Now, more and more doctors are becoming aware of this and the disease called Hashimoto's, and again, more and more doctors are testing for it. But there is no way of knowing that you have it unless you get tested and you have your antibody levels tested. Okay, so that's mistake number 1. Get your antibody levels tested and don't take iodine unless you like to gamble with your health. Number 2, switching from one medication to the next. This is something I see very often, but also relying on T3 replacement alone to treat your thyroid disease or treat your Hashimoto's. Now, let me first address this T3 issue. If you know you have Hashimoto's disease, I don't ever recommend taking T3. Again, this is too much of a gamble, and here's why. A person with Hashimoto's disease often flops back and forth in between these states of hypothyroidism and hyperthyroidism. So too much and too little. If you happen to be moving towards a hyper flare and you're taking Cytomel, or you're taking Armour, or you're taking some other T3 combination that has the ability to put your Hashimoto's in a flare-up, okay? In other words, you're going to be over-medicated, and some of you know this can happen, and it can happen in the blink of an eye, all right? You'll develop all these hyper symptoms. You'll have heart palpitations. You'll have this inward trembling. You'll feel like you're on edge. You'll feel like you're really losing control of your life. Many of you will end up in the emergency room thinking that you're having a heart attack, right? The doctors will make you wear a heart monitor for the next 24 to 48 hours, and eventually you're going to be told that nothing is wrong with your heart, that you just had an anxiety attack. And of course, what happens next? The doctor comes along, he sends you home with a prescription for some anti-anxiety pills. That's one issue, okay? But the bigger issue here is that taking thyroid medication alone, and again, I don't care if it's T3 or T4, natural or synthetic, thyroid replacement alone will never correct the underlying cause. There's so much talk these days about low T3, Armour, Cytomel. But again, these never ever treat the root cause of why your thyroid is not producing or converting hormones. You see, low T3 is not the problem, okay? The cause of why you have low T3, that's the problem, right? So does hormone replacement replace low T3 levels? Yes, of course it does. But it does not address the reason why your body can't make sufficient amounts of T3, causing low T3 syndrome. So it will never ever fix that. Does it address the conversion issue of why you can't efficiently convert T4 into T3? Never, all right? So no matter what dose, what brand, or what formulation of thyroid hormone that you're taking, it still has to be converted by bacteria in the gut and a healthy liver. There is no medication that can fix these things like leaky gut or gut dysbiosis or fatty dysfunctional liver, all right, or an elevated stress response or a nutrient deficiency. These are the true root causes of why there are these problems. Does taking thyroid replacement stop the immune system's attack on the thyroid, right? If you have a genetic predisposition towards Hashimoto's? No, never, okay? So unless you've had your thyroid removed, where you absolutely must take thyroid hormone, I believe it is more prudent to investigate the real reasons of poor production, poor conversion, and of course, thyroid resistance, all right? So what else could be sabotaging your thyroid recovery? Reason number 3, relying on medication or relying on thyroid replacement to fix all of your problems if you have Hashimoto's disease. Okay? I talk to too many patients that for years and years and years know that they have an autoimmune thyroid disorder, and the only thing that they do is they take thyroid hormone. Some felt better, some felt worse, but you'll see in just a moment why this is destroying your health in the long run. When it comes to Hashimoto's, I want you to imagine this scenario. I want you to imagine that the Navy or the Air Force is attacking a battleship, and instead of trying to stop the Navy or the Air Force, the commanding officer says, there's nothing we can do about that attack, so just start bailing out the water with some buckets. Okay? This is, unfortunately, this is the mentality of the medical community and in general when it comes to thyroid disease or Hashimoto's disease. I see too many functional medicine doctors that becomes their sole focus, is this T3 replacement as well, okay? Again, there's so much more here. Ignore the attack, just replace the hormone. Again, this is why your doctor is only testing your TSH and your T4 levels, all right? If you have Hashimoto's disease, okay, you need to work with a functional medicine doctor who will look and identify your autoimmune triggers. And this is so very important. These autoimmune triggers are the key to stabilizing your immune system. And the most important thing to understand about this is that they vary from person to person to person. It may be things like food sensitivities, all right? It may be due to a high viral or bacterial load from things like herpes or Epstein-Barr virus or H. pylori or Lyme disease. It may be things like a leaky gut. It may be nutritional deficiencies that are impacting conversion. It may be inflammation. It may be a chemical reactivity. The point is, when dealing with autoimmune diseases, you have many, many, many triggers that you need to contend with and identify, okay? Only after these triggers have been identified can you now start the road to true recovery. Diet alone is a starting point. Going on a gluten-free diet is a starting point. But again, I see too many people thinking that diet alone is going to fix their problem, and it won't fix it. It's just the start. Now, with all this being said, I do want to make a disclaimer, okay? Never, ever, ever stop taking your thyroid medication unless the doctor who prescribed it to you has instructed you to do so, all right? If I was to tell you to stop taking thyroid medication, I would be guilty of malpractice, okay? I don't know you, unfortunately. I don't know anything about you, so I have no right instructing you on what you should or shouldn't do from a medication standpoint, right? So that's my disclaimer. Moving along to reminder number 4, when it comes to sabotaging your thyroid treatment, all right? Number 4 is not having your doctor run a complete thyroid panel. You know, I've talked about this and the importance of this and the importance of having a complete thyroid panel in many, many past videos and articles. I won't spend too much time on this because I feel like, again, I've addressed this already. But I do want you to know that there is no one singular reason why your thyroid's failing, all right? There are many, many reasons, and to start that process of unraveling all of this, you really need to have a complete thyroid panel. That's the start. Now, once you have this complete thyroid panel, now whoever you're working with, your functional medicine provider, can determine the pattern of thyroid dysfunction, and from there, that provider can now determine with specialized testing what was the true root cause. In other words, they'll help uncover and unravel why that pattern exists. All right. Now, a while back, I spent some time putting together a free thyroid guide, and if you don't have that yet, I do encourage you to download that. I'll leave a link in the description box. You can visit my website. You can download it. It's free, but it will help you understand, again, these different patterns that we're talking about that, again, we just don't have time to get into in this video. Now, my last point about all of this is that trying to navigate thyroid function without this full thyroid panel and without specialized testing is really like trying to navigate the open seas with only the moon and the stars as your guide, as opposed to a GPS. Right? I always come back to that point, and I point out to patients that if your thyroid was the sole cause of why you feel so sick, why your health is so poor, why you continue to get sicker with time, okay, then taking thyroid replacement would fix everything if it was just a matter of low levels. But if you're watching this video, then you already know that there is much more going on here than just your thyroid. Right? Now, my final point, point number 5, is you need to look at the big picture. We're all different. We all have different stressors. We all have different occupations. We have different biological makeups. Your solution to restoring health is not going to be found in someone's book that offers a protocol for you to follow that thousands of other people are doing. Right? Everything from testing to diet to supplementation to lifestyle changes, that all needs to be tailored to your needs, and it needs to be based on testing. Even if you have an identical twin who also has a thyroid problem, maybe perhaps they even have all the same symptoms as you, testing and treatment still needs to be tailored to the individual. All right? Now, here's what I do in my practice that helps me have the success in helping patients that I have. It's based on a number of steps, and number 1 is what we call a case review. My new patient application and paperwork takes the average person 2 to 3 hours to complete, plus 7 days worth of food journaling. The paperwork is not something that can be filled out in 15 minutes before an appointment. Unlike most offices where a patient fills out that paperwork in 10 or 15 minutes and they're done, the doctor or nurse spends another 3 to 5 minutes looking at it, if that, and then orders the same testing on every single patient. The medical community just hasn't figured out yet that that doesn't work for patients with thyroid disease, and it definitely doesn't work with patients who have Hashimoto's or Graves' disease. So for me, how I practice, I need to know all the details. I need to know my prospective patient's health history. I need to know the entire health history, from birth to present. I need to know about the pivotal events or the past infections or past treatments, some of the emotional stressors in that individual's life that may have set this kind of into motion. I need to know what kind of medications that the patient's taking or the surgeries that they've had that perhaps might be part of the problem. Right? Next, I ask patients to type up a 3 to 5 page health narrative. I want to know all the details. These are the things that usually people forget when they're in the doctor's office, when they're rushed in and rushed out. Maybe they're nervous. Maybe they had a stressful drive over to the doctor's office, and they had a couple questions they wanted to ask the doctor. But in that 3 to 5 minute, 10-minute visit, they just didn't have a chance to convey those thoughts. All right. So again, today's appointments, they're really designed to herd people in and out of a doctor's office, and that's really due to the limitations and restraints that insurance places on doctors. Patients, again, rarely have time to ask those questions before they're out the door and before they get that prescription. So this is not healthcare, right? This never works for thyroid patients. Number 3, I ask patients to complete a 7-day food journal, and this needs to be completed so that I can see not only what you're eating, but I want to see what you're not eating, right? And are you eating a nutrient-dense diet, or is your diet filled with things that are really robbing and stealing from the ability to heal, right? Next, I use a metabolic assessment questionnaire. This helps categorize a variety of metabolic imbalances and patterns. Number 5, I implement a neurological assessment questionnaire. This helps me understand the impact that the thyroid is having on different parts of your brain. Perhaps what neurotransmitters may be a contributing piece of the puzzle. Do I need to order certain tests that are going to help me understand if the brain is inflamed, or if there's certain amino acids that might be throwing off how your body is producing certain neurotransmitters like serotonin and dopamine and those anti-anxiety neurotransmitters like GABA. All right. Number 6, I use a toxicity questionnaire. And finally, I like to review all the past testing that a patient has done in the last 12 months, right? I want to see what biomarkers were run, why were they run, if they were positive, were they retested, and of course, you know, what was missing from all of that. All of this is what goes into what I call a case review. And only after I spend an hour or two reviewing all of this information can I then determine the specialized testing and the biomarkers that I'm going to need to run in order for me to understand and unravel that patient's case. I do not have a set list of tests that I run on every single patient with Hashimoto's or thyroid disease like some doctors. And I want you to realize that that's so important. You are not just another number, you're not just another patient, but your testing and your treatment, again, needs to be tailored to you. Right? Now, the other thing we do is we incorporate nutritional and dietary counseling into a program for our patients. Right? In addition to patient working with me, a patient's also going to get paired up and work with one of my awesome certified nutritionists who will help guide them and coach them and encourage them, as well as implement and carry out a dietary plan that, again, has been tailored to them based on testing. That's what I call a case review. Does it take time to review all of this? Of course it does. But again, I believe it's the #1 reason why we have the success that we do in helping some of the most difficult and most challenging cases that are out there, right? So there you go. Those are my 5 things that I believe are sabotaging your thyroid treatment, plus an explanation, of course, of what I do in terms of my case review. And that might be something you want to compare to what other doctors are doing, if that makes sense to you, right? So I hope that helps you. And until next time, I'm Dr. Hagmeyer. Take care.